So we're going to talk a little bit about evidence-based practice for nurse leaders. Hopefully in your research course and many other courses you've gotten exposed to a lot of the definitions related to evidence-based practice, practice guidelines. I know that we mentioned and talked about translational research, so some of these definitions that are listed here, make sure that as part of your study for testing, for ATI for nursing leadership, as well as for just for ongoing testing in our class, that you do take some time. If any of these are not real familiar definitions, look these up in your book so that you have a good idea of what their meaning is and how that would relate to a leader's capability or need to know about that. There are models presented in your book, the Iowa model and the Iowa model revised. And so those are just two of the most prominent models for working with evidence-based practice. We talk about EBP from a nurse standpoint, but as a nurse leader, the focus is even a higher level of expectation, not only for you who graduate with a bachelor's degree, are you going to be expected to know about these things, because your role and maybe a little higher level of education puts you in a situation where you tend to move into leader roles, and you aren't just learning these things so that you know what they are when your nurse manager does them or puts them in place, but before too awful long, you are going to have the skill set to really drive evidence-based practice changes and processes, both at the unit level, at the department level, at the organization level, and sometimes even outside and across levels in an organization, or even out into the community. So that's the main reason for making sure that you get this in your leadership course, and at least an overview. Some of these things are crossing into different courses that you may have, so I don't want to restate them too awful much, but just make sure you're very familiar with them, because they definitely pull into testing in this course and testing in your ATI for management and leadership. So these are some of the typical steps for performing EBP. You want to pick a patient disease that's really a pertinent issue for your area. You're doing that as part of your team-based leadership service learning plan, and you're going to be looking at some data and things for that as well. But be thinking about this. You'll do this, if you haven't already worked on some projects on PCOT, you will definitely be doing some of this in other courses. But the key thing is giving kind of a systematic way for kind of evaluating and setting up a way to put practices that are evidence-based in place. Key resources for investigating evidence-based practice are all of our online search databases. Your PubMed and Medline tend to be more medical and disease focused, whereas CINAHL and Ovid tend to be a little bit more cross-disciplinary type resources. And CINAHL is the Cumulative Index for Nursing and Allied Health Literature. So if you're really searching for very specific nurse-based interventions, you're more likely to find specifics there than on some of the others. Also know that the Cochrane database for systematic reviews is a huge repository for systematic reviews, and systematic reviews are where other researchers have went out and already done a huge lit review on a particular clinical problem or a specific disease or different things that they might have researched, and so they have then taken that and had that uploaded to this systematic review and so system, and then you can go there and look at, somebody's already done a lot of the work for you. You would want to also look at what was the year that review was published. And so, if it was, say, published in 2019, great, it's probably pretty up to date. If it was published in 2015, then you wouldn't stop there in doing your searches for evidence-based practice. You would then go back to your other primary search databases and search from 2015 till current to make sure anything that has happened since that Cochrane review has been published. You've probably had some time knowing and getting a key about what medical subject headings are. We do have librarians on campus that can assist you further, and the nursing department has its own librarian that can really help you focus. So if you're needing help, always reach out to the library because they do have a specialist just for our department. You're going to hear, if you haven't already, hierarchy of evidence. And so when you're trying to look at all this literature that you now compiled as a leader, what of it is any good, or what of it is really valid or reliable research? The way different kinds of studies are designed are going to give you a higher level or a more valid measurement, I guess is the way you would look at, or more higher caliber of results. So if you have a randomized controlled trial that was very large and looked at a specific nursing practice or a certain health condition situation for a large number of agencies or a large number of patients, then it's very high level if it's telling you that evidence is showing something needs to be done a certain way. If you just have a qualitative or descriptive study, that is much lower in terms of, well, we should suddenly just stop the press and change all our practices in my nursing unit to do it based on this descriptive study. So when you're looking through things and trying to look at what's the evidence for what we're doing on my unit, or changing to a specific thing that's out in the literature, you have to go by the hierarchy of evidence to make your decision. So again, systematic reviews or meta-analyses, which are many quantitative studies that have kind of all been analyzed together, are the highest level of evidence that's out there on a subject. So if you have that, then you start there, and then you look at other things that maybe weren't part of that review that could add to the higher evidence, and then you come out from looking at all that and kind of begin to design a strategy of how, as a leader, would you roll out an evidence-based practice. There are some models that you can use. The Diffusion of Innovations is one model. There is an evidence-based practice implementation guide that you can refer to, and a few other strategies. You may be starting some very large program of a new service along a certain evidence-based practice line, or you may be having a very small just a little change in one piece of how nursing does a specific procedure, let's say. And so just realize that as the leader of a department, wherever that might be, inpatient or outpatient, you're not going to just always be involved in one practice change at a time. You have to kind of think using change theory. How many things can you have going at one time realistically? And whether small incremental practice changes may be more effective than trying to roll out a huge plan at one time that's very complex. So these are some of the ways that evidence-based changes are made, and kind of using your leadership knowledge to think about and models to kind of think about the best way to go about it so that those practices don't just get put out there, but they actually do fully get implemented in the care of the patients in an ongoing way. Your book gives you a few visuals in terms of implementation strategies, and I just threw a couple slides in here that show some of those actual components. In terms of really having an evidence-based practice exemplar, you're the leader, and now you've got to go about presenting an idea that you want to change. And maybe it's something that needs to change across the organization. Maybe it's just something that you're wanting to get approval to do on your area only. But you have to provide them with sort of a proposal document that outlines all this, because you're going to use that as your method to show not only how am I going to do it, so you have that, but also you want to be able to show the powers that be above you. You have strategy. You want to be able to use this exemplar as a way to convince people on your team of the importance of it and show that you've done your homework before you start something. That document is going to be set up with having a purpose, a rationale. It may talk about a specific model or framework that's utilized to kind of plan it by. You want to show that you have went through the evidence that's out there. Sometimes that might be presented in a table format of the different articles or the different research studies that support it, or it might be a written literature review on several pages that outlines why the change really makes sense and why the evidence is so strong, making the case for why then next, what is the practice change that you're wanting to do, what implementation strategies you're going to use, and be very detailed there. When, where, how, over what time period, what are all the steps in it. You want to also denote in your exemplar that you're going to send forward for approval how are you going to evaluate this as the implementation takes place. And then after the project is over and done, you would go back to your document and look at the implementation strategies where they followed. You may want to edit that and really show what really ended up happening versus what was done. And then in your evaluation, you may want to look at data after the fact. So your full evaluation of an EBP is not going to always be right in the moment. It's going to be many months, a year or two later, and you may show data from before throughout, as well as writing a full conclusion of whether this really was an effective, evidence-based practice change. And then you've got yourself a nice little article that you can put in a journal somewhere. This again is another graphic for you that just kind of shows another piece of the implementation. And I also wanted to show you typically graphics you're going to see related to EBPs being done. You will have baseline data that shows where we have been in terms of measures of quality prior to the project go live, and then ongoing monitoring after the fact. This graphic shows the ventilator-associated pneumonia rates and counts, and so that was just a way when they implemented change they did that. You want to be able to have the ability to build EBP capacity and knowledge and know how that works to be an excellent leader. Leaders all the way up the chain have got to be extremely well versed in EBP and how to put those out and do those effectively. All nurses really play a huge role in these. but nurse leaders have got to be great at really pulling in all the disciplines that are important to do and motivating people